March is Colorectal Cancer Awareness Month. The specialists at Blue Ridge Digestive Health, gastroenterologists Deborah Levenson, Duane Moise, and Nate Krogel, want you to know what everyone should know about colorectal cancer. It's preventable, it's treatable, and it's beatable.
Colon cancer is the second leading cause of death from cancer in the United States. It's expected that over 50,000 people will die from colon cancer in the year 2015. However, the death rate from colon cancer has been dropping over the last 20 years, and that's largely due to screening and improved treatment of colon cancer, especially colon cancer which is diagnosed at an earlier stage.
For the average individual who does not have a family history of colon cancer, the screening age is at age 50. In 2009, due to the rising incidence of colon cancer in the African American population, the American College of Gastroenterology reduced that screening age to age 45. The risks of polyps are slightly greater in men than women. We believe that these polyps are what grows and turns into colon cancer later on. So essentially, if these polyps are found early and removed during a routine colonoscopy, it significantly reduces the risk of a patient developing colon cancer. Essentially, no one should die from colon cancer if they're screened appropriately.
Colon cancer screening, known as colonoscopy, has a reputation as an unpleasant experience, but almost all of the mild discomfort that patients experience comes from taking the liquid preparation used to clean out your digestive system, not from the procedure itself.
Screening is a lot more comfortable than it used to be. Our scopes are more flexible than they were. The prep is a lot more palatable. The majority of the preps are actually much smaller in volume. Generally, the sedation is much better, so most patients aren't aware of the procedure at all.
I like to tell my patients that it's really important to get screened because colon cancer is a preventable disease. If patients show up for their screening, we can, catch things in time. It's really unfortunate when we do find something or a patient has a poor outcome, and you think back if they would have shown up for their routine screening when things were recommended, then it would have been caught and we could have done something about it. If they have any concerns or questions, I'd tell them to come to the office. We can discuss the procedure, what we're going to do, hopefully alleviate fears and address concerns. And I also have to give credit to our anesthesia department because they're the ones responsible for making patients comfortable, and it's very rewarding when a patient wakes up and can't believe that the procedure is already over. It shows that their experience wasn't horrible, and if they need to show up, if they need to have a recall in 1, 3, 5, or 10 years down the road, then they're not going to be as against it as they might have been before.
The earlier a disease is diagnosed, the more likely it is that it can be successfully managed or cured. That's why prevention is so important.
Most important is a healthy diet and lifestyle. Diet, exercise, maintain your body mass index within normal range will help avoid getting into the obese range. Diets high in fiber, low in red meat, high in fruits and vegetables, lack of cigarette smoking. Those are the things we can do to reduce our risk of developing colon cancer.